Hello and welcome to this recording of the Pharmacy First Clinical Pathways Update. My name is Simran and I'm the Service Development and Support Lead for Community Pharmacy Surrey and Sussex. As you will be aware, updates have been made to the Pharmacy First Clinical Pathways, which are live as of the 1st of October 2025. The purpose of this recording is to provide a summary of the changes to the clinical pathways, but for any queries, please do contact us on lpc@communitypharmacyss.co.uk. This recording will cover each pathway and the changes as noted by Community Pharmacy Surrey and Sussex for contractors' reference. Please note it remains the responsibility of all clinicians delivering the service to ensure they have read and understood the changes. This is not an exhaustive list of the changes, therefore clinicians will need to read the documents published by NHS England and ensure they are confident in providing the service, that they are practicing safely and in line with the service specification. Please also note this summary does not include any changes to the PGDs and protocol. Please ensure your IT system suppliers have incorporated the changes to the pathways. The IT system suppliers had planned to amend their existing systems to incorporate the updates on the night of the 30th of September 2025. However, contractors must check their individual systems to ensure these changes have been incorporated, and please do contact your IT system supplier if there are any issues. The recording and slides are available on the Community Pharmacy Surrey and Sussex website, where you will be able to access any links to documents. So the key changes to all pathways, you will see the addition of the NICE clinical knowledge summaries to each of the pathways in the top left-hand corner. You'll also see each condition has been linked to its relevant condition on the NHS website for further information. And more emphasis has now been placed on the red flag consideration. For each of the pathways, you will see the addition of a gateway point for urgent escalation to A&E or calling 999, and you will also see some clarifications of definitions on certain pathways. We have linked the service specification, clinical pathways, PGD and protocol on the slide, so please do ensure you have read these and understood the changes before providing the service. So starting with the uncomplicated UTIs for women, you will see this pathway now excludes women with diabetes. There is a new gateway point which has been added for escalating to A&E or calling 999. Pyelonephritis has been clarified as a flu-like illness, urethritis clarified as caused by irritation or inflammation, and dysuria clarified as acute pain or burning sensation when passing urine or at the end of urination. For the shingles pathway, again, you will see the new gateway point for escalating to A&E or calling 999. A new addition you will see is shingles affecting the head and neck as a red flag for onward referral. The gateway point has now been moved, so any suspicion of shingles is claimable, and non-truncal has been defined as limbs or perineum. For the impetigo pathway, all examinations must now take place in the consultation room. Again, as with the other pathways, the addition of the new gateway point for escalating to A&E calling 999, and the gateway point has been moved so that any suspicion of impetigo is now claimable. With the infected insect bites pathway, there is the addition of new red flags to consider, such as Lyme disease. Again, there's the addition of the new gateway point for urgent escalation to A&E or calling 999, and the previous gateway point has now moved to allow claiming for self-care advice. With the acute sore throat pathway, there's the new gateway point for urgent escalation to A&E or calling 999. Children require a thorough consultation for acute sore throat. There is the addition of possible signs of mouth or neck cancer for pharmacists to consider for onward referral. And then there's a new gateway point added for self-care advice if patients present with a fever pain score of 2 or 3, and an additional gateway point for patients returning to the pharmacy. For acute sinusitis, again, as with the other pathways, you'll see the addition of the new gateway point for escalating to A&E or calling 999. The gateway point has moved to allow claiming for acute sinusitis as a potential differential diagnosis, and you'll see the addition of regular pain relief with self-care advice. With acute otitis media, again, the new gateway point for escalating to A&E or calling 999. The gateway point has moved for clearer otoscopic examination requirements, and again, you'll see the addition of regular pain relief with self-care advice. As mentioned before, the purpose of the recording is to summarise the changes to the clinical pathways to help pharmacists delivering the service focus on any personal and professional development needs. Each individual delivering the service must ensure they have read the updated documents provided by NHS England and ensure they are competent to work under the service. For any queries, please contact us on lpc@communitypharmacyss.co.uk.